To start. はい、おはようございます。
おはようございます。
Happy New Year. Too late. Yes. じゃあ、let's start. Restart again about this course. Okay. So today's program is about the last year I have asked you to think about the human death and organ transplantation. So therefore, these 2 weeks we will discuss about the alternative way, the medical scientific approach today, and the next week is the engineering approach. Engineering approach means the introducing about artificial organs or artificial tissues or something. Okay. Hi. Okay. Today's topic is about the heart disease. Ischemic heart disease means the lack of blood flowing, so not applying to some energy to the muscles, so therefore some heart muscle will be weakened and also die. So therefore some diseases happen. To prevent this, after making happening these diseases, what will be treatment is these 2. And the next part is latest medical technology. One is Batista operation, and the other is brain hypothermia therapy. And the regenerative medicine will be presented. Okay? So this is today's content. Yes, what is ischemic heart disease? Yes, this is a recall about this disease, heart diseases. As I have explained, this is because of the lack of blood provided. Yes, I will show this video first. Coronary heart disease.
Cardiac compromise is a blanket term that refers to many kinds of problems with the heart. Just as there are many problems, there are a wide variety of signs and symptoms associated with these heart problems. As an EMT, it is much safer to treat all patients as though they are having a heart problem, rather than diagnose the specific disorder. With that in mind, let's take a closer look at 5 of the most common heart conditions. Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall, resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal. Acute myocardial infarction. Acute myocardial infarction occurs when a portion of the myocardium, heart muscle, dies as a result of oxygen starvation. The dead area can no longer pump. This can lead to cardiac arrest, shock, pulmonary edema, or congestive heart failure. In some cases, heart attack patients suffer cardiac rupture as the dead tissue area of the heart muscle bursts open. Medications called thrombolytics dissolve clots that block coronary arteries. Other patients receive an angioplasty, a balloon device, to open the arteries. Aneurysms. Weak spots that dilate are known as aneurysms. When a weakened artery bursts, rapid internal bleeding occurs and tissues beyond the rupture can be damaged. A rupture of an artery within the brain can result in a severe stroke. If a major artery ruptures, death from shock can occur. Arrhythmia. A malfunction of the heart's electrical system will generally result in an arrhythmia. Electrical disturbances within the heart result in arrhythmias, including bradycardia, abnormally slow, less than 60 beats per minute, tachycardia, greater than 100 beats per minute, or rhythms that are present when there is no pulse, including ventricular fibrillation, ventricular tachycardia, pulseless electrical activity, and asystole. Congestive heart failure, CHF. Congestive heart failure, CHF, is a condition of excessive fluid buildup in the lungs and other organs because of inadequate pumping of the heart or a failure of the lungs to function properly. Congestive heart failure can be caused by diseased heart valves, hypertension, or some form of obstructive pulmonary disease. The symptoms of CHF may include tachycardia, shortness of breath, elevated blood pressure, cyanosis, profuse sweating, cool and clammy skin, pulmonary edema, pedal edema, or the coughing up of frothy white or pink sputum. Late signs include engorged pulsating neck veins or enlarged liver and spleen with abdominal distension.
This video shows 5 diseases around the heart. Yes, one is the heart. The coronary artery is no flowing, so therefore the heart will be died. A part of the heart will be died, and also some clot go to the brain, and more smaller vessel will be stopped. So therefore the brain stem cell will become damaged. Is one failure, and another is a final disease about the heart valve not closed correctly. So therefore it cannot pump so much. So, and also the one before that is about the control signals problem. So sometimes it is heartbeat is more frequently, and sometimes heartbeat more slowly. So therefore it not works well to provide the heart the blood. Yes. These two is also interesting. So if you have something, it takes 5 minutes. Heart failure and acute coronary syndrome and high blood pressure problem. If you have some time, please watch it later. Yes. One of presently, yes, we will discuss about the how to solve the what is the treatment about when the coronary artery will be stopped. Yes, one way is some drug is delivered to this part, and this clot will be melted or divided into small parts by drugs. So by using some injection or making the catheter to provide that part, this drug will be delivered to that part, and the clot will be melted. This is called the PTCR, percutaneous transluminal coronary recanalization. Yes, recanalization. Please reactivate the blood flow. Yes, the other way is, as you can see in the video, by using the catheter, the balloon is here and the balloon is put on this part, and by using some flat inside of this balloon and make this part open again. But in some cases, it makes damage to the blood wall, the blood cell wall, blood vessel wall, and it will also make some damage to this. And in this case, after restoring this balloon, sometimes clot may happen. Yes, in long term, the narrowing will be possibly. This possibility of again narrowing is very high. So therefore, it's not the complete treatment to this. But firstly, balloon or plain old balloon angioplasty, POBA, has been applied to prevent the re-narrowing. So therefore, the stent, coronary stent, is this kind of mesh-like tube. So this is around this balloon. This mesh tube is here, and if it is opened, expanded, it is put it inside. It is stored, located inside of this vessel. So I will show this video a little bit old, but coronary artery angiogenesis stenting. Now this is closed.で、ここのところにこのケーブル入れて、ここはバルーンでステントがここにあって。30-meter long graft built-in stent guided into the present along the wire. Stent is expanded to full size with balloon. So therefore flow it again. Expanded sentence, blood flow is increased. と言っています。ということで、medical doctor is doing this kind of operation while working the heart. Yes, so it is very difficult to place the exact place and the balloon will be expanded and stent cells, stent will be replaced at the correct position. Yes. ちょっともうちょっとアニメーション、こっちの方がアニメーションにしたいんです。ちょっとアニメーション見ましょうか。
Coronary angioplasty, also called percutaneous transluminal coronary angioplasty or balloon angioplasty, is designed to restore the flow of blood through coronary arteries narrowed or clogged by atherosclerotic plaques or blood clots. When you arrive at the hospital, an intravenous line will be started. You will be placed on a heart monitor and you will be given an oral or intravenous sedative to help you relax. Most coronary angioplasty procedures last between 30 minutes and 3 hours. The doctor numbs the skin in your groin area and inserts a needle into your femoral artery. Once the needle is placed, a guide wire is passed through the needle and gently guided through the arterial system to the heart. The needle will be withdrawn and exchanged for a small flexible tube called a sheath, permitting access to your femoral artery. At this point, you will be given a blood thinner to reduce the risk of blood clots. Next, a soft, flexible catheter is slipped over the wire and threaded up to the heart. The procedure is monitored using a continuous X-ray imaging device called a fluoroscope. You may feel pressure as the wire and sheath are inserted through the groin and pushed through the artery, but you will not feel their movement inside your arteries. At this point, your doctor will remove the guide wire, position the tip of the catheter just inside the coronary artery to be treated, and inject a special dye. The dye allows the fluoroscope to take X-ray images called angiograms of the artery's interior. Any blockages will be clearly identified as the arteries fill with the dye. You may feel flushed or slightly nauseated when the dye is injected. Once the blockage is identified, your doctor will insert a flexible guide wire into the artery and advance a balloon-tipped catheter over this wire and into position at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing blood flow through the artery. You may feel some chest pain while this is happening. The same procedure is repeated for each blockage being treated. Afterwards, your doctor will withdraw the deflated balloon and catheter from your arteries. Some patients will receive a coronary stent, which is a small tube made of wire mesh designed to prop open the artery once it has been treated. A collapsed stent is placed over the deflated balloon as it's moved into position. When the balloon is inflated, the stent expands and locks into place. After the balloon and catheter are withdrawn, the stent remains behind to hold the artery open permanently. After your procedure, a pressure bandage will be applied over the femoral artery to prevent bleeding. You will need to lie on your back for several hours, during which time you will be checked periodically for any signs of bleeding or chest pain. You may either be discharged home on the same day or after an overnight stay in the hospital.
But sometimes it's also the, as I said in the medical materials part, yes, this material is artificial material, so therefore in some cases the clot will be appeared again around this stent. So in that case, once its stent is placed in some places, it cannot be replaced. It's permanently placed inside of the body. So at that time, it is also again closed. Another way has been applied, like this. The bypass, coronary artery bypass grafting must be done. So bypass means some other tube will be applied. Not directly here, but the bypass tube will be added outside of the heart. Okay, so therefore the some part is in some cases the artificial vessel will be applied, and in some cases the another part of this kind of vessel will be used by patient own vessel will be used for the bypass grafting. Okay, yes, for example, this is the femoral region. Yes, femoral. This part of the vessel will be cut and placed on here. Or this mammary artery is this part of the vessel will be cut and placed on here. And the stomach's fibrotic artery. Yes, this vessel is this is the stomach, and the stomach blood providing vessel will be placed on here. And also in some cases, this radial artery will be cut and placed on here. Yes. So therefore, in this case, the coronary artery bypass grafting (CABG) will be made like this. In that case, the heart-lung machine, artificial heart-lung machine, will be used. The blood circulation pump is, and also the blood oxygenation apparatus will be used. Yes, in some cases, the heart is also working, so therefore the stabilizing equipment will be used. Yes, this equipment is pushed onto the heart, and in this the medical doctor will do some surgical operations to cut and place and yes, without stopping the heart. Yes, OPCAB, off-pump coronary artery bypass grafting, is also used. A stabilizer is using. ちょっとこれ見てみますか。どれがいいかな。これか。
To begin the operation, a 6 to 8-inch incision is made in the chest, and the sternum is slit down the center. A retractor is inserted and used to further open the space created, revealing the thin layer of tissue covering the heart known as the pericardium. Another incision is made and the pericardium is secured out of the way, providing the surgeon with a clear view of the heart to perform the operation. During bypass surgery, the heart is cooled and stopped. In order for the patient to continue receiving oxygenated blood, the heart is connected to the heart and lung machine. Carefully monitored by a technician at all times, this pump filters and oxygenates the patient's blood and recirculates it through the body. Typically, the greater saphenous vein of the patient's left leg is used for the bypass, and with groundbreaking technology, this vein is extracted from the leg through a hole roughly the size of a dime. The extracted vein bypasses the blockage by connecting to the aorta and the area just beyond the blockage on the heart.
というような手術をするわけですね。なんかそんなもんですね。で、前へ。これステントわかりますかね。で、ステントは as I said, this makes the plaque, it create plaque again. So therefore, the plaque will be cut and stored inside of this cutter. Yes, like this. The rotating cutter is cut this plaque and stored in this head part, and then it is removed from this part. Yes, so I will show this video. これだ。
DCA, directional coronary atherectomy, like PTCA, is a minimally invasive procedure to remove the blockage from the coronary arteries and allow more blood to flow to the heart muscle and ease the pain caused by blockages. The procedure begins with the doctor injecting some local anesthesia into the groin area and putting a needle into the femoral artery, the blood vessel that runs down the leg. Once the needle is inserted, a guide wire is placed through the needle into the blood vessel. Following this step, the guide wire is left in the blood vessel and the needle is removed. An introducer is then placed over the guide wire, after which the wire is removed. A 35,000th-inch guide wire is put in its place. Next, a diagnostic catheter, which is a long, narrow tube, is advanced through the introducer over the 0.035-inch guide wire into the blood vessel. This catheter is then guided to the aorta, and the guide wire is removed. Once the catheter is placed in the opening or ostium of one of the coronary arteries, the doctor injects dye and takes an X-ray. If a treatable blockage is noted, the first catheter is exchanged out over a 0.035-inch guide wire for a guiding catheter, after which the wire is removed. Once the guiding catheter is in place, a 14,000th-inch guide wire is advanced across the blockage. Then, a catheter designed for lesion cutting is advanced across the blockage site. A low-pressure balloon, which is attached to the catheter adjacent to the cutter, is inflated such that the lesion material is exposed to the cutter. A drive unit located at the proximal end of the catheter is turned on, spinning the cutter. A lever on the drive unit is advanced by the physician, which in turn advances the cutter, cutting away pieces of the blockage. These lesion pieces are stored in a section of the catheter called a nose cone and removed after the intervention is complete.
Nose cone.
Together with rotation of the catheter, the balloon can be deflated and re-inflated to cut the blockage in any direction, allowing for uniform debulking. A device called a stent may be placed. This is a latticed metal scaffold that is placed within the coronary artery to keep the vessel open. After the intervention is completed, the doctor injects contrast media and takes an X-ray to check for any change in the arteries. Following this, the catheter is removed and the procedure is completed.
Contrast material is provided and then check which part is blocked, which part is replaced, or which part is recovered or something. Okay. So again and again, this kind of material is applied. And also not only this kind of devices, but presently so many kinds of devices has been developed, like this movie shows.
Of the 1 million heart attacks that occur in the U.S. every year, 375,000 are ST elevation myocardial infarctions, involving large coronary thrombi that are eligible for thrombectomy. In addition, each year over 200,000 patients with peripheral arterial disease are in need of clot removal. Rapid and complete removal of arterial clot from either coronary or peripheral arteries can potentially salvage tissue, improve clinical outcomes, and reduce mortality. Unfortunately, existing thrombectomy devices suffer from major limitations. Simple aspiration catheters often leave 30 to 50% of the clot behind. Multiple catheter exchanges are needed when large clot is present. In addition, mechanical thrombectomy devices are associated with a high risk of adverse events, particularly distal embolization. Fragmentation of the clot during thrombectomy frequently occurs, sending hundreds or thousands of emboli distally, which leads to reduced blood flow, tissue death, and significant morbidity and mortality. The Megavac vacuum extraction thrombectomy system solves limitations of existing technologies, setting a new standard in clot removal.
The megavac is actually 4 devices in one. It occludes the artery completely. It protects against embolization. It acts as an anchoring device, and it rapidly, completely, and efficiently removes arterial thrombus. Let's watch how megavac vacuum extraction thrombectomy works. The catheter is first positioned just proximal to the clot. The funnel mouth at the tip of the catheter is then deployed, occluding blood flow with its silicone elastomer on the distal aspect of the funnel. This results in the mouth of the funnel tip being maximally expanded in a radial fashion by the patient's own blood pressure, creating a seal against the arterial wall and arresting blood flow. Cessation of blood flow prevents clot fragments from traveling downstream, greatly reducing the potential for distal embolization. The patient's blood pressure, along with the radial force of the funnel tip, combine to press the device against the arterial wall, anchoring the catheter firmly and safely. The outward expansion of the megavac anchors and centers the device and can be used as an anchor for other devices in crossing tight lesions or tortuous vessels. Once the megavac arrests blood flow, the thrombo wire is inserted through the catheter, advanced through the clot, and deployed distal to the clot. While applying suction with the megavac, the thrombo wire is retracted to simultaneously pull the clot into the funnel mouth and through the catheter. After complete clot removal, suction is discontinued and the catheter tip is undeployed, restoring distal blood flow. Rapid removal of occlusive thrombus with vacuum extraction can accelerate door-to-balloon time and improve outcomes. In summary, there is currently a large unmet need for rapid and efficient thrombus removal in cases of coronary and peripheral arterial thrombosis. The megavac system provides a 4-feature solution in one device: occlusion, protection, anchoring, and removal. Megavac is easier to use, with the potential to be safer and more effective than current devices.
But this is mainly applied to the healthy or younger people, because some elderly people is become hard about the vessel wall. So therefore, yes, if it's also this flexibility is there, it's okay to do this kind of treatment. But some elderly people is making this vessel, coronary vessel, become hard. So therefore, plaque will be there. So therefore, it's so this treatment is applied some of the people, but some of the people is not good, I think. Yes.
Which translates into improved blood flow, less tissue death, and more patients' lives saved.
This kind of device is also developed. So therefore, to develop this kind of devices, engineer is necessary to develop this kind of systems. Okay. Yes. So yes, this is a bypass. And another topic is about the dilated cardiomyopathy, DCM, is the making the heart beat, yes, high blood pressure, making the high blood pressure, or in some cases, the heart muscle become larger and larger, and heart muscle wall become thick and thick. So therefore, in this case, yes, heart is ballooned and the main cause is not clear presently. So some kind of cases, it looks like the basketball is ballooned of the heart. So in this case, the heart transplant is a final decision to treat this kind of disease. But the one Brazilian doctor will do this cutting of these heart muscles, remove this part, and it goes well. It about early 80s. This Dr. Batista started this kind of surgical operation. So therefore, this kind of directly cutting off the heart muscle is called the Batista operation. Yes, で、これ見ますか？あ、ちょっとこれじゃあ、これは長いので、3分ぐらい。Yes, here.
Lone Star Heart. Treatment of dilated cardiomyopathy with Algicel. The healthy heart performs with flawless consistency as it pumps about 2,000 gallons of blood and beats 100,000 times per day. Powered by highly specialized muscle cells, the heart's chambers and valves work in tandem, as shown here, to circulate vital blood. However, this normal pumping capacity decreases significantly in patients with congestive heart failure, when the muscle cells are damaged and impaired by underlying conditions such as an infarct, atherosclerosis, or high blood pressure. Trying to compensate in reaction to the damage, the weakened muscle wall around the left ventricle is subjected to much more stress. With increasing stress, the wall dilates, stiffens, and becomes thinner. Pumping harder but less efficiently, the ventricle continues to enlarge and the heart takes on an abnormal circular shape. To stop and reverse this disease progression and reduce stress, Lone Star Heart has designed a novel biopolymer-based therapy for the treatment of congestive heart failure that can be used in a less invasive or in an open surgical intervention. The procedure begins with the determination of the area of greatest stress along the enlarged left ventricle. Typically, this area is located at the midpoint of the ventricle along a perpendicular line. The circles indicate this line and the sites where the biopolymer will be delivered. Next, adequate access to the heart is created. In the surgical setting, this is accomplished through the sternum or through an opening in the rib cage. For delivery, the biopolymer, which has the consistency of a thick gel, is placed in a syringe that is connected to a special needle and optional tubing. As it is injected into the muscle in predetermined quantities, the biopolymer gel hardens somewhat to form a mass or a body that immediately thickens the wall. The inert implantable biopolymer is highly compatible with the local tissue, and its consistency is such that it does not interfere with the beating motion of the heart wall. However, in aggregate, the injected materials have the ability to reduce ventricle size and modify the abnormal circular shape of the dilated left ventricle.
これは、recent way. So some part is injected inside of this muscle wall, and therefore the coordination about this heart is coordinated. So therefore it prevents more larger and thicker of this heart muscle. Yes, this is one way to...
The treated ventricle, shown here next to a normal heart, acquires a more normal shape and thickness. The consequence is a reduction in stress, an improvement in pumping efficiency as shown by ejection fractions, and a stabilization or reversal of disease. Lone Star Heart's treatment for congestive heart failure, shown here, is being evaluated in controlled human clinical studies to confirm its overall safety and efficacy.
Well, it means heart is important about balancing each four chambers. So one of the part is some destroyed or some weakened or something. It changes its coordination. So in that case, some part is become more pressure will be applied. So therefore the heart muscle will become thick, and balance will be changed. Once balance will be changed, the more disease become deeper and damaged more worse. So therefore, this treatment is changing its condition to rearrange again about the coordination. Yes. はい。で、ということで、ドナーが不足してラッケンをドナーで、traveling transplant is very expensive, and so therefore this operation is applied to many patients. Yes. Another way, when the brain is damaged, the keeping the activation of heart full body will be reduced. So therefore, the full body's temperature become lower is one treatment when the heart is damaged, seriously damaged, heart and also the brain will be damaged. So this is called the therapeutic hypothermia for brain injury. This. By using the bracket, so the heart brain disease, one of the most important part is oxygen supply and also the reducing the oxygen consumption in the brain. So therefore, the managing of supplying the oxygen, managing the temperature, managing the energy is very, very important. So therefore, the hypothermic treatment is one way to reduce the activation of human body for several days, and after that, if temporary condition, make it temporary condition or usual condition, then the recover the full body, whole body's temperature again. So by using this, the cooling bracket is used. For example, water-cooled type blanket is used. In some cases, normally the human body is 37 degrees Celsius, but the reduce the 5 degrees or 2 degrees in some cases. To keeping in the lower temperature, the recovering the condition is expected. これ、どっかこれお見えるかな。
A really cool medical technique is saving lives following cardiac arrest. Welcome to Memorial Health and You. With us today is Dr. Joseph Beausarge, Memorial Intensive Care Unit Medical Director. Dr. Beausarge, what's the principle behind hypothermia therapy?
Therapeutic hypothermia is based on observations of drowning victims in icy water being revived after long periods of time with little or no brain damage. Following some key studies in the last decade, it was adopted by the American Heart Association for use in post-cardiac arrest patients who remain unconscious. During a cardiac arrest, blood flow to the brain is interrupted. Tissue damage occurs and can continue to occur even after blood flow is restored. Therapeutic hypothermia minimizes this damage and gives patients their best possible chances for a meaningful recovery.
So how does it work?
In the intensive care unit, the patient is heavily sedated. Cooled water is circulated through insulated pads, lowering the body's core temperature to approximately 92 degrees for 24 hours. This slows down metabolism and protects the brain and other vital organs. Then, we gradually rewarm the patient back to normal temperature. During this time, the patient is closely monitored in our ICU. Overall, it can mean shorter ICU stay, less time on the ventilator, improved neurologic outcomes, and a better survival rate. Amazingly, some patients can recover with this therapy even if the heart has been stopped for 20 minutes or longer.
Thank you, Dr. Beausarge. If you'd like more information on therapeutic...
まあいいや。というわけで、このhypothermia operation will make the surviving rate increase. Yes, not just after some accident, the operation will start, not good, and keeping the lower temperature of the whole body days or after several days, and then the recovering, the rewarming again, and the treatment is more better in some cases. Yes, this is an example. And the final part of today's topic is regenerative medicine. Transplantation of cell and transplantation of tissues. セル transplantation in some cases. For example, the Parkinson's diseases, some brain neural cell will be injected into the brain, and then the recovering is one part. And the other part is tissue engineering. Yes, for example, the skin tissue will be generated and then planted onto the patient. This is a short story. The 1981, the skin cell, dermal tissue will be succeeded, regenerated. And the tissue engineering workshop will be held partially. And some cartilage, the ear shaped, this is, I will explain later. And then some articular cartilage is also the clinical test, and also in Japan is also started. And ES embryo stem cell, embryonic germ cell is also applied, and so on. Yes, ちょっとこれも見せたけど、Yes, I will show this video first.
Tissue engineering, also called regenerative medicine, refers to the attempt to create functional human tissue from cells in a laboratory. Its ultimate goal is to be a cure, not merely a treatment, by repairing or replacing tissues and organs that fail due to disease, genetic errors, congenital abnormalities, or traumatic injury. Tissue engineering relies on 4 important factors: the right cells to do the job, the right environment, such as a scaffold to support the cells, the right biomolecules, like growth factors, to make those cells healthy and productive, and physical and mechanical forces to influence the development of the cells. The cells can be directly harvested from the target organ, developed from precursor or stem cells, or taken from lines grown in the lab, all ideally from the patient, as that limits problems with rejection. The supporting structures can be derived from donor tissue, or from natural or synthetic polymers made to order for their strength or endurance. Biomolecules can be added directly, or coaxed from the cells that take up residence on the scaffold. Sometimes the scaffolds dissolve over time, but others remain to provide support to the organ. Some examples of tissues and organs that have already been successfully tissue engineered and implanted in humans include bladders, small arteries, skin grafts, cartilage, and even a full trachea.
From this video you can understand. To do this regenerative engineering, one element is scaffold. Scaffold is a 3-dimensional structure. Around this the cell is planted, and this is the foundation, the framework of some organization. Yes, firstly it is only on the shell So therefore, the two-dimensional tissue can be created. But presently, the three-dimensional scaffold will be used to make the three-dimensional tissue structure, three-dimensional organ structure. And then the secondary is a stem cell. Yes. Stem cell is a seed of the structure, seed of the tissue, organ. So the stem cell can be divided into different kind of cells. So therefore, how to acquire this stem cell is an important part. And thirdly is adjustment. How to make the targeted organ, targeted tissue. So therefore, some mechanical stress or some chemical something or some stimulation will be applied to the stem cell, and then make it into the targeted tissue. So these three parts is a requirement of this. So therefore, one of the important part is a stem cell. What is stem cell? I will show some videos like this. あ、これじゃないか。これか。あ、これはいいよ。これかじゃあ。あ、動かない。これかじゃあ。
Stem cells these days. But what are they? Where do they come from? And what do we really know about them? Inside our bodies there's a microscopic world, busy and complex like the world around us. Stem cells build and maintain this world. This is a story of stem cells and their lives inside and outside our bodies. Life begins with one cell, the fertilized egg. Throughout development, cells divide over and over again to produce the billions of cells that make up the body. At certain stages, most cells stop making copies of themselves and start to specialize. When we are fully formed, almost all of our cells are specialized.
Cells are very beautiful things when you see them down the microscope. Normally they're so minuscule we can't see them, even though they won't make us. And each type of cell has its own characteristic. Some types of cell grow together, very closely together, and form beautiful patterns. Other types of cell will move away from one another. Some cells become big, other cells are always very small. It depends on what type of cell they are.
These different cell types work in specialized teams. Some carry oxygen through the blood system. Some do the stretching and contracting in our muscles. Some carry messages between our brain and the rest of our body.
Stem cells are very special cells, and they act as a reservoir, really, because the specialized cells can no longer make copies of themselves. So if they die, get used up, and they have to be replaced from somewhere, and this is where the stem cells function.
まあいいや。というわけで、how to acquire the stem cell. One way is this embryonic stem cell. This is before birth. the cell. Firstly, it is first and divided into, and then it is divided into several characters, several kind of cells. So by using this, the embryonic cell is one way to get the stem cell. But this is also has some ethical problem. Yes. Do you think when is a human being become? What is the first of the human being? After birth from the mother is only human being, or the inside of the mother's body is also the baby, it's also the human being, or yes, which part is a human? We want to think. Yes, this is also the ethical problem. Yes, only this one cell is also the human being. If it is so, we don't have to use this embryonic stem cell. Yes, it means it's also the human being. It's also using in experiment or scientific research is also the meaning of killing the human being. Yes. So many kind. Yes, for example, I have shown this video, the stem cell research ethical and immoral problem. So therefore, presently the second way, from adults the cell, how to build the normal cell into the stem cell is the ES cell or EP cell is the working. Yes? なんだっけ？どっかに ES セルとか EP セルとかこれだ。これね。The embryonic cell or EG cell. This is not good. But the somatic stem cell from the bone marrow or some other places, the normal human bodies and take its cell and make it into the stem cell. It's many researchers emphasizing on this presently, because to prevent the ethical problem of this the embryonic stem cell problem. And as I said, the third part is the three-dimensional scaffold. Yes, I will show this new material testing. ちょっと見ますか? Yes. あ、これじゃないのいいか。ちょっと待ってね。これじゃないの。こっちの方がいいか。This is firstly, this video shows the one part of the movie as I introduced last. Island.
Go on.
People grown their human clones. Harvest body part from the clone. Harvesting from the clone, the organ, and send it to the patient. れはこれsome research organizations promotion video. So this kind of tissue engineering this organization is doing. So therefore introducing this movie and then at that time condition tissue engineering is introduced. Patient is own self making the tissue or organ. The three-dimensional tissue organ, how to develop. The scaffold is necessary. Scaffold structure, then three-dimensional structure will be made. Firstly, the two-dimensional. Nanofibers mesh is good for the scaffold. Yes, for fine mesh is good for the scaffold. And natural products of the natural fiber is good for working inside of the body. It's no problem. So therefore, the nanofiber mesh structure they are developing, researching on this. Finer is more better to making the tissues and organs itself. So therefore, not only on this petri dish, but yes, it's only the. So therefore, firstly, only the skin is developed by using this cultivation. By this cultivation, but presently some three-dimensional organization like the vessel tube. Yes, so many kinds. Yes, firstly it's only the skin, but to the joint, the articular cartilage and the membrane or blood vessel, bone, some part of bone, and blood cells is also created by tissue engineering. So as I said, firstly it is announced 1995, more than 20 years ago. The BBC, British Broadcasting Corporation, provides some TV program, documentary program about this tissue engineering. The 3 scientists in the United States, transplant surgeon, and anesthetist, and also the molecular compound researcher will join this kind of. So this is ear mouse. This picture is very, very shocking. So therefore it became famous. So mouse ear like this. What do you call
Boston, Massachusetts. At first glance, it seems impossible. Yet, like something out of science fiction, this animal may actually become a trailblazing hero. American scientists have successfully grown and attached a human ear onto the back of a mouse. The ethics are controversial, though many believe this is horrifically cruel to the animal. Others see an amazing breakthrough that could save lives. How was such a feat accomplished? It's the brainchild of doctors and brothers Charles and Joseph Bacani and a team of researchers at Massachusetts General Hospital. Scientists initially believed it was impossible to graft and grow anything more complex than simple human tissue onto another living organism. That is, until now. Intricate and highly developed, an ear is the most difficult cartilaginous tissue to reconstruct. Yet the team has found a way. They start by recruiting the help of specialized, mutated mice. As this video shows, this mouse has no hair, and inside its wrinkly pink skin is a body without a functioning immune system. Such a mutation will assure the mouse's body will accept the foreign human ear tissue. To create the ear itself, the scientists carefully insert skin cells into a highly specialized mesh-like ear mold. Once it's complete, the mold can be grafted onto the mouse. As these images reveal, the laboratory mouse-grown ear gives great hope. Though the ear doesn't function as a hearing organ, it's a perfect living replica. If this is possible, doctors believe similar mold transplant technology may one day work for humans, helping people regrow their own organs, repairing deformities, or even for life-saving transplants.
In a nutshell, what we had hoped to do is demonstrate the ability to grow new functioning tissue, so living tissue.
This is only the demonstration. So the three-dimensional scaffold-like pieces inside implanted into the mouse's body, and then some tissues is generated around this. So therefore, it makes this shape, only this shape. No providing the blood or some energy or something, so therefore it doesn't work well. Only the shape of these cells. So it's only demonstration. But it is very, very sensational for at this part, at that time, 20 years ago. Yes? So the rest of the part is only the example of tissue engineering, some skins or some fibers, and also the brain cells, brain nerve cells, and also the liver is also developed, and the transgenic organ. Yes. This transgenic organ means the human gene is inserted into the animal organ because directly only for example, pigs or some mouse's tissue or organs is implanted into the human body. It makes some differences between the species, so makes some problems. The difference because of the difference of species. So therefore, to implant from the pig's liver, the pig's liver is implanted by the human genes is inserted into the pig's liver, and then after that, this pig's liver is implanted into the human. To do this, this transgenic organ is also researched, now researched and developed. source organ is implanted into the human.
So there is a shortage of organs for transplantation into humans in the U.S. So one solution to that would be to have animals that can donate organs for humans. And most of that work is being done in pigs currently because pig organs are the right size and function to substitute for human organs. There are genetically engineered pigs that have been engineered with some human proteins on their cell surface so that the organs won't be rejected as quickly when the pig heart, for example, is transplanted into a person.
So, to prevent rejection,
that is also regulated by the Food and Drug Administration as a medical device, essentially. And there are concerns that pigs contain pathogens, pig pathogens, that once put into a human organ recipient might mutate and infect humans. Because you're putting that organ with a potential pathogen into a human who's immunosuppressed because they've received a transplanted organ. The efforts are to raise pigs in extremely clean conditions so they have no pathogens. But in that specific example, pigs carry what's called an endogenous retrovirus.
Some retrovirus pig has, so it makes the damage to the human. So, but because the pig's main organ, heart or liver, is the similar size of the human being. So therefore, it is easy to transplant to the human body. So therefore, the pig is one target of this kind of transgenic animals. Yes. Almost. Sorry, I have over this time. Yes, it's okay.